It's one of those things we all know we should do, but somehow it always ends up at the bottom of the to-do list. I'm talking about the annual health checkup. Today, we're going to break down why this one simple appointment isn't just about ticking a box. It's truly one of the most powerful investments you can make in your long-term health. So let's start with a really honest question. Think about it for a second. Do you only make that call to the doctor when you're already feeling sick? When that cough just won't go away or some new ache or pain pops up? If you're kind of nodding your head right now, hey, you are not alone. But what if that whole approach is, well, backward? See, there's a better way, but it requires a totally different way of thinking. Most of us, we practice what's called reactive healthcare. We wait for the problem, the symptoms to show up, and then we react to it. The alternative is proactive care. It's all about preventing problems before they even start. It's about building a solid foundation for your wellness, not just running around fixing things after they break. Okay, let's really get into this. Here's what we're going to cover in this explainer. First, we'll talk about what preventative care actually is. Then, we'll decode what really happens during a checkup. We'll help you figure out if you're due for a visit, show you why it's such an amazing investment, and finally, give you some simple ways to take control. So, first up, let's get beyond this whole idea of just waiting for symptoms. We need to understand what preventive care really means. It's actually a pretty simple idea, but man, it has the power to completely change how you look at your own health. The general health checkup isn't about finding out what's wrong. It's a proactive look at what's right, what the risks might be, and how to stay well. The best way to think about it is like getting your car serviced, right? You don't wait for the engine to completely seize up on the highway before you get an oil change. The exact same logic applies to the most important and complex machine you'll ever own, your body. All right, so you've made the appointment. Now what? What actually happens when you walk in for one of these wellness exams? Let's pull back the curtain and take a look. It's basically a straightforward 4-part process, and each step kind of builds on the one before it. It all starts with just a conversation, a chance to go over your history and any family risk factors. Then comes the physical exam for a hands-on evaluation. After that, lab work gives you that crucial look under the hood at key health markers. And finally, all of that info gets pulled together into a personalized game plan, just for you. And when we dig a little deeper, you can see this isn't just a quick once-over. We're talking about gathering real data points like your blood pressure, your cholesterol, your blood sugar, that create your personal health baseline. It's also the time for important screenings, for checking in on any conditions you already manage, and even for getting some practical advice on things like nutrition and stress that affect you every single day. So all of this naturally leads to a really practical question. How do you know if it's time for you to schedule a visit? Okay, I want you to treat this less like a slide and more like a personal checklist. As I go through these, just ask yourself if they apply to you. Has it been over a year? Do you have any known risk factors? Maybe a family history of an illness? Have you been feeling weirdly tired or noticed any unexplained changes? Or maybe you just want to know where you stand to get that baseline of your health. If you checked even one of these boxes, it's probably time to make that call. And now we get to the real payoff, the big why. Because this is so much more than just another appointment. It's honestly one of the smartest investments you can possibly make in your future self. The single most powerful benefit here is something called early detection. See, these routine exams can spot the very quiet beginnings of major conditions. Think heart disease, diabetes, things like that, long before you would ever feel a single symptom. And catching something at its earliest, most treatable stage, that can completely change the outcome. It's the difference between making a small course correction now versus dealing with a major crisis later. And this really gets to the heart of what all the experts say. It's not some complicated strategy. It's simple, it's proven, and it is absolutely one of the most effective tools you have to protect your health for the long haul. Okay, so maybe you're convinced, you're ready to take charge and book that appointment. What are some simple, practical things you can do to make sure you get the absolute most out of that visit? A little bit of prep goes a long, long way. First, just gather your info. A list of any medications you're taking is essential. Second, don't try to remember everything in the moment. Write down any questions or concerns you have before you go. And third, a super simple one, just ask if you need to fast for any blood tests. These 3 little things can make your visit so much more productive. Look, if you walk away with just one thing from all of this, let it be this right here. This isn't some complex theory. It's a fundamental truth. Preventive care isn't an optional add-on. It is the absolute foundation that a long, healthy life is built on. So let's end by turning all this information into action. I'm not talking about some giant leap. It could be something really small. Maybe it's just looking up a doctor's phone number, or maybe it's jotting down that one question you've been meaning to ask. So what is one small thing you can do today to invest in your future health?